Well, good evening and happy Saturday. This is Janice Johnson from Cancer Out Academy. Information for the patient, the caregiver, the survivor, and everyone in between. Well, I'm back, family, with an update on Medicaid expansion here in the state of Alabama. We talked about this some months ago and haven't reported on it since about April. Because we were trying to wait for some updates. Well, I have just come back from a meeting that was held tonight at the Birmingham Civil Rights Institute. It was sponsored by the American Cancer Society's Cancer Action Network, an organization for which I have the privilege of being a part of. I want to give you some updates on Medicaid expansion. The first thing I want to let you know is that it was reported tonight that our Governor Kay Ivey, has kind of shifted her position and is stating that she would like to expand Medicaid in Alabama, but she is concerned about where funding will come from in the long term. I think for the first couple of years, maybe the first 6 years, it appears that that could be handled, but beyond that, she has some questions and some concerns. What we would like to do is encourage Governor Ivey to just kind of really just take a leap of faith. She's a woman of faith, so we're asking her to just take a leap of faith and go ahead and extend Medicaid in the state of Alabama, understanding that there are realities associated with funding programs like this. But on tonight, I was made aware of quite a few case studies that I just did not know about, and my heart is completely softened toward this topic even the more because of the number of people that are affected. I want to give you some pointers from some notes that I took at the meeting tonight, just to kind of share with you exactly how important it is that Medicaid be expanded, particularly in Alabama. One of the focal points of tonight's meeting was the Black Belt. And we know that to be counties like Greene County, Otago County, Mobile County. Some of those counties are the poorest in the state. And we want to highlight one of the things that just blew me away. And that is in one particular county in the state of Alabama, in Otagoville, actually there is one doctor, y'all. Dr. Lee Carter, one doctor for the entire county. And he was interviewed in a movie that was presented to us tonight called Justice. And he was talking about the fact that patients come to see him, and of course he sees them, but these people are unable to pay, and they have a heart to pay. They're not looking for handouts, and some of them try to barter. They try to bring things, like if they have raised crops or whatever, they try to bring something to the doctor to at least show their appreciation. Y'all, this is antiquated. This stuff oh my God, this is so far behind where the United States of America should be, let alone the state of Alabama. We have got to expand it. It's not really an option when you got people that's trying to take in a bushel of peas to pay for, an exam. It just doesn't make any sense. And we just want to take this opportunity to thank Dr. Carter for his heart and pray to the Lord's protection over him, because he's got to live and he's got to eat and feed his family as well. But these are some of the things that we're looking at in the state of Alabama, and while we are continuously rallying to try to get Medicaid expanded here in the state. From what we understand and from what was reported tonight, if Medicaid was expanded in the state of Alabama, 90% of the support to do that would come from the federal government, and the state would only have to cover 10%. Now, I'm not going to try to get into where that 10% is coming from, because I don't know. I don't work for the state of Alabama. I have much respect for my legislators and my governor, because I don't know what they face every day. But I do know that people really, really, really need to have the opportunity to go to the doctor. And just from a practical standpoint, if people had health care, they could go to their doctor's offices and get treated instead of going to the emergency room and sitting and sitting and sitting and sitting. Because now, if you go to the emergency room, unless you're bleeding and just really, really close to death, you're going to be there 6, 7, 8, 9 hours before you get treated, which really is not emergent care at all. So we really need to do something different. And I believe that if we were to extend Medicaid in the state of Alabama, that would reduce the traffic that's actually in our emergency rooms, and that's a win for all of us, not just the people who don't have health care, but just for everybody. It was reported that there are a number of rural hospitals that are actually on the cusp of closing. We know that anywhere between, I think it was reported, 9 to 11 hospitals in the state of Alabama in rural areas have already closed. And we definitely don't need to see any more hospital closings. That's just, again, antiquated and unheard of. We had some very esteemed panelists that was there tonight and was leading the discussion on the expansion of Medicaid here in the state of Alabama. Just to kind of bring it home, we had 2 ministers, we had a primary care physician, people who are in the know, really in the trenches every day, that was reporting on what was going on and how the fact that Medicaid hasn't been expanded, how it's impacting the healthcare field as well as patients who are uncovered. And it was reported that the Alabama Hospital Association is on board because they need to have the funding. They need to be paid so that they can keep their doors open and keep their workers open. And, it's just very clear that we need to do something to expand Medicaid here in the state of Alabama. I was actually at the doctor this week because I'm getting ready to make a trip to Washington later on in the week to try to speak to those that are there in Congress about expansion, healthcare, and a number of different things. And I had the opportunity to ask my doctor, what would what message would you want to send? And he's such a wonderful doctor. He made the comment about, the importance of letting our healthcare workers, our nurses and support staff know that they are appreciated because they do a large amount of work for us. And I have to agree with that. So I just think that expanding Medicare in the state of Alabama, from what I have learned and what I have been exposed to, would definitely be a win for the state. We are getting some negative press about being one of the worst states to live in. We've got high crime in some areas, different things. So Governor Ivey, if this ever reaches you, I would just like to say thank you for all that you are doing. Please consider, please work with your staff and your advisors to try to see if you can get Medicaid expanded here in the state of Alabama. And let's get us out of the news for such negative things and leave a legacy that one of the things that happened under your administration was the expansion of just human rights, the right to be able to go to the doctor and be taken care of like anybody else. This is Janice Johnson from Cancer Out Academy. Remember, you should live and not die prematurely. And one way to do that is to ensure that everyone has health care. I love you guys so much. Have a wonderful day.